Hi, my name is Melissa. I'm a nurse with the Villages Health as well as a population health specialist. We're going to do the seminar for hypertension, which is high blood pressure. So thanks for joining in. First, we want to start out with what is hypertension? What's the definition? So this is sometimes called high blood pressure, HBP, or HTN. Hypertension can have a deadly consequences if left untreated. About 75 million American adults have high blood pressure. So 1 in every 3 American adults have this diagnosis. Some may not even be aware. A study done in 2013 showed 360,000 American deaths included hypertension as a primary or a contributing cause of death. So that's almost 1,000 deaths each day that hypertension played a part in. That's a crazy number, and the numbers continue to go up. It's pretty scary. So what is blood pressure? This picture here on the slide shows a little bit better. So blood pressure is the measurement of force applied to the artery walls. So you see the white arrows there pointing to the top and bottom. That's the force that's being applied to each side, to each of the different sides of the artery walls. Over time, if the force is too high of the blood flow, the tissue that makes up the walls of the arteries gets stretched. Once it's stretched to a certain limit, the damage occurs and you can't necessarily fix it at that point. So having high blood pressure is like having high pressures in a pipe. The damage is happening inside, but on the outside, you may not know anything's wrong. The outside may look fine, but on the inside, the pressure is happening, the damage is happening, and you may not know there's a problem until that pipe bursts. So that's a different way to look at it. It's a little scary once you really think about it. So the left picture where the pipes look nice and clean and no issues at all, but on the right, that's all of that damage and force that was happening on the inside that eventually wore its way out. And then you have the damage, you have the pipe burst. So different way to look at it may put it into a little bit better perspective for you. So this is a basic guideline for blood pressure. You see the different colors. So we have green is normal, yellow is considered elevated, and then the oranges and the red are considered hypertension. Those are high blood pressures. So the normal, you have your systolic, which is the top number, would be less than 120. And then the diastolic, which is the bottom number for your blood pressure reading, would be less than 80. So normal is considered less than 120 over 80. Now, an elevated blood pressure would be considered for your systolic 120 to 129, and then your diastolic still less than 80. So if your top number is a little higher than 120, if it's in the 120 to 130 range, then it is considered elevated. That's not considered normal. Then you have your oranges there. So high blood pressure, stage 1, hypertension, 130 to 139, or your diastolic 80 to 89. So you don't necessarily have to have both your top and bottom numbers be high to be considered with the diagnosis of hypertension. It could be either one. The top or bottom number may be in that higher range, and then you would be considered with hypertension. Stage 2, the darker orange, is 140 for your systolic or higher, or your diastolic to be 90 or higher. So you could have a blood pressure that's 135 over 72. That 135 still puts you in that high blood pressure range. You could also have a blood pressure that is 120 over 95. So that, again, still puts you in that high blood pressure range. So it doesn't necessarily have to be both numbers that are elevated. It could be one or the other. So it's a very good idea to make sure you're monitoring your blood pressure. When you go into your doctor's office, it does tend to be, for most people, a little higher. because for whatever reason, walking through the front door of a doctor's office or maybe seeing the technicians or the nurses, white coat syndrome, we see that a lot here. So if you check your blood pressure at home and keep a log of it and bring that in for your doctor to review, that'll give them a really good idea of what your blood pressure is running on a normal basis. Because we do know for most people when you come into the office, it is slightly more elevated than it may be at home. You can see on the very bottom, that dark red, it says hypertensive crisis. This is a medical emergency. If your blood pressure is higher than 180 and or the lower number, the diastolic is higher than 120, you need to contact your doctor immediately to see what treatment they want you to do, because that's very dangerous to have your blood pressure that high. So call your doctor if you notice your blood pressure is ever within those ranges, but make sure you're also keeping a log of your blood pressure, and then take it into your doctors so they can see if your numbers are starting to trend up into that elevated or even high blood pressure range at home, where you're comfortable, you're in your chair. That's where we need to know if it's getting higher. So what is the most common symptom of blood pressure? Anybody know? Most people don't have any symptoms of high blood pressure. That's why high blood pressure or hypertension is often referred to as the silent killer. Going back to the picture of the pipes, on the outside, those pipes looked pretty much spotless. They looked brand new. But on the inside, there was so much damage happening that we didn't know there was a problem until the pipe busted. So you definitely want to make sure you're keeping a close eye on your blood pressure, keeping a log of it, because if it is starting to trend in the upward range, even the elevated range, the doctor should know about it so they can monitor you more closely. So we talked about on that range some of the symptoms of what's called a hypertension or hypertensive crisis. This is a medical emergency. So the common symptoms we see are severe headache, nausea or vomiting, unusual confusion, vision changes, could be blurred vision, could be doubled vision, could have some nosebleeds, chest pain, or shortness of breath. Like I said, these are the most common symptoms we see with the hypertensive crisis. So if any of these symptoms do occur, it's a great idea to check your blood pressure, have a seat in a comfortable place, check your blood pressure, and see if it is elevated. If so, you need to call your doctor immediately to see what treatment they would suggest for you to get your blood pressure back down. If high blood pressure is left untreated, it can actually cause some very serious health issues. That's why, again, we rely on the patients to monitor your blood pressure at home and let us know if it is trending a little higher than it normally would. So it can cause symptoms like, or health issues like a heart attack, even stroke. Hypertension can also cause heart failure or kidney disease or kidney failure. It can cause some permanent vision loss. There are different arteries in our eyes, so if our blood pressure remains high, it can cause that high pressure, which could then lead to permanent damage. Also, some sexual dysfunction. In women, we can see low libido or erectile dysfunction in men. It can also cause some angina, which is that tightness, heaviness, pressure that you feel in the chest, which is sometimes associated with a heart attack. Hypertension untreated can also cause some peripheral arterial disease that's affecting the arteries in the lower part of the body, in the limbs. Also an aortic aneurysm. So the aorta is the main vessel that carries the blood away from the heart into the rest of the body. So it could actually cause an aneurysm in there and then cause some leakage with your blood. That could also be a serious medical emergency. Having high blood pressure and not treating it could also cause some cognitive dysfunction. It can cause some memory issues. So if you notice your numbers are trending upward, or if you're concerned, keep a log of it. If you do see it trending, talk to your doctor so they can start treatment for you to keep your blood pressure in the range that it should be and not left untreated. Some risk factors or causes of high blood pressure. We'll go over some of those. Now, some of these you can modify, some of them you can't really control. So we're going to go over the different types here. So first we'll talk about some modifiable risks or some causes for primary hypertension. So these are things that you can adjust. If you're not physically active, that puts you at a higher risk that can cause some high blood pressure. Also, eating an unhealthy diet. Maybe you're living a sedentary lifestyle and not eating the proper foods. You're eating a lot of fried processed foods. That puts you at a higher risk for high blood pressure. Being overweight or obese also puts you in that risk, in that category as well. Even drinking too much alcohol, having sleep apnea, people with high cholesterol and diabetes are also at a higher risk for developing a diagnosis of hypertension. Then smoking or tobacco use, as well as excessive levels of stress, are all risk factors and can cause hypertension. These are also all things that are modifiable. You can control. Sometimes you might need some help to control them, to get them under control, but there are still things that we can adjust. So that's a good part about it. Now, these are some things you can't change. These are the non-modifiable risk factors or causes for primary hypertension. Your family history, maybe you have a strong family history of high blood pressure. That's something you cannot change. You cannot do anything about that. Your age, although we may not like the number of our age, still can't change it. You might tell people you're a different age, but looking on the birth certificate, that's the amount of years that your body is old. So that's something that we cannot modify. As well as our gender and our race, also non-modifiable. As well as if you have a diagnosis of chronic kidney disease. These are all things that you cannot modify. You cannot change if you have any of these risk factors that could in turn cause primary hypertension. As much as you might like to, we can't change them. So another thing we're going to talk about is called secondary hypertension. Secondary hypertension is where you develop high blood pressure or hypertension from a different, secondary to another medical issue. So if you have renal artery stenosis, so narrowing within the kidney arteries, that could pose a diagnosis of secondary hypertension, as well as Cushing syndrome. Some thyroid symptoms can also cause some problems with your blood pressure. Obstructive sleep apnea, coarctation of the aorta, certain medications even can cause some high blood pressure. That's why it's important to make sure you're reading those little pamphlets that you get with your prescriptions and some supplements, because some of them do say that they can cause elevated blood pressure. So that's important to know, so you can keep a closer eye on your blood pressure. And if it is starting to go up, report that to your doctor. They may want you to stop that. Some other issues there, you could get secondary high blood pressure from other medical issues. So it's important to make sure you're aware of this, you're monitoring your blood pressure if anything changes. And if you know it's trending, if it's getting higher, let your doctor know so they can work with you to get your readings where they should be. So now we're going to talk about getting the diagnosis of hypertension. So I'm sure everyone can agree that at some point in your life, you have had your blood pressure checked. Whether it be a manual blood pressure cuff or an automated blood pressure cuff, which is called a sphygmomanometer. During the test, they place the cuff, or you can place the cuff around your upper arm. Now, generally speaking, the arm cuffs we found to be more accurate than the wrist cuffs. The wrist ones are a little harder to calibrate. Reason being, sometimes if you don't have the placement just right, you might not get the most accurate numbers. So we suggest the arm cuffs over the wrist cuffs in general. So you put the cuff around your upper arm, You need to be aware there should be a little arrow or a little mark, maybe a little dot on the cuff to show you exactly where the placement should be. It should be at the bend of your arm. You'll see the arrow points there. So the arrow should not point to your elbow. Your feet, both feet, should be flat on the floor with your back resting against a chair or against a wall. You should be comfortable, both feet flat, sitting back in a chair when you're checking your blood pressure. Once the cuff is inflated, the cuff then compresses on the brachial artery. That's that artery that's at the bend, inside bend of your arm, momentarily stopping the blood flow. And then the air in the cuff is slowly released while the person is performing the measurement, either by listening with the stethoscope, or if it's an electronic machine, it does it itself. Your blood pressure results will show in two different numbers. So again, your top number is your systolic. The diastolic is bottom number. The top number, your systolic, indicates how much pressure your blood is exerting against your artery walls during heartbeats. And then the diastolic, your bottom number, indicates how much pressure your blood is exerting against your artery walls while the heart is resting between beats. So your systolic is during heartbeats. Your diastolic is resting in between the beats. So your heart rate and your blood pressure don't necessarily have to increase at the same rate. Depending on what activity you're doing, depending on a few different factors, your heart rate may stay within the range that it generally runs, say if it's usually around 65 or 68, and your blood pressure is a little high, that's okay. But then again, keeping track of your blood pressure and writing the log to take into your doctor is important, to write your pulse and your heart rate and your blood pressure down together, because all of those things are important when they're making their decisions on if treatment is necessary. So you do sometimes get that high blood pressure diagnosis, whether it be from in the office or they review your blood pressure log from home, a few different things, but there are some other tests that may be done after you get a hypertension diagnosis. They may want to check your urine. They might want to do a urine analysis just to make sure there's no abnormalities with the urine, nothing that you're excreting through your urine. They may also want to check your cholesterol, a BNP that can check for congestive heart failure, a BMP that can also check some of your other levels, your sugar, or an EKG. This is where they put the stickers on your chest and they can check the rhythm and rate of your heart. They may want to do an EKG just as a basic guideline to see if there are any changes there. Just get a baseline when you first get a hypertension diagnosis to see where you are, so they can see if there is an abnormality with your heart's rhythm or if the rate is different than what it had previously been. So these are some common tests that we do see after an initial hypertension diagnosis. So don't be alarmed if they order these, it's okay. So you get the diagnosis, you talk to the doctor, you ask your questions. So the next question that you ask, okay, well, what's the treatment? What are we going to do? So first, there are some lifestyle changes that you can make that you don't necessarily need the doctor for. You can start on a heart healthy diet, limit your alcohol. If you don't drink, it's not the good time to start. Make sure you're staying physically active, managing any added stressors that you have in your life. Also maintain a healthy weight. That's very important. If you smoke, it would be a great time to quit. And then if medications are prescribed, make sure you're taking them as directed. If they suggest taking them twice a day, make sure you're taking them the time that they recommend. Trying not to miss any doses because that can throw your blood pressure out of range. So starting first with that heart healthy diet, Try to make sure you're including a very good variety of fresh fruits and veggies every day. When choosing your dairy, you want to choose for the fat-free or low-fat, that 1%. Cheeses, milks, and yogurts, trying to avoid the 2% or whole milks. Your protein should be lean protein sources like beans, nuts, seeds, soy products, and lean forms of meats and poultry. With your poultry, try to get skinless because we know that that skin does have a lot of fats in it that can be harmful for our bodies. Now for fish, you should be having, the guideline shows 8 ounces of fish per week. So if you want to break that up into 2 servings per week, fine, but we know that fish is good. That's helpful for, it provides us with different omegas. So we need fish. Also, make sure you're including whole grains into your diet. The first ingredient should be whole grains. It shouldn't be a word that you can't pronounce or you're not really sure what it is. You should also limit the amount of refined grains that you're eating. Also limit the calories that you're getting from added sugars. And then replace any saturated fats that you are eating with unsaturated fats. So the unsaturated fats are better for us than saturated. So try to replace those and limit the saturated that you're eating. Now with alcohol, this is quite a touchy subject when we have this seminar in the office. So we're going to go over it in pretty good detail. So like we said, if you don't drink, it's not a good time to start. If you do drink, maybe just watch the moderation. So you can drink still, but try to limit it. There are some studies that show women should be having 1 drink per day, limit to 1 drink per day. For men under the age of 65, you can have 2 drinks per day. For men over the age of 65, it is 1 drink per day. Now you can see in the picture on the top right corner, that is considered, those are all considered 1 drink. You can't have all 4 of those. You can have 1 of those to be considered your daily drink. So a 12-ounce can of regular beer, 8 to 9 ounces of malt liquor, 5 ounces of table wine, or 1.5 ounces or a shot of 80 proof liquor. So each of those would be considered 1 serving size, 1 drink. Now you can't save all of your drinks up. If you don't want to drink during the week, you only drink on the weekend. You can't save them all up and use them all on Friday or Saturday night. It doesn't work like that. It's just 1 drink per day. So drinking too much alcohol can actually raise your blood pressure. If you've been diagnosed with hypertension or high blood pressure, your doctor may suggest that you reduce the amount that you drink, or even suggest that you stop drinking because that can play a big toll on your blood pressure and you may have a harder time getting it down within the recommended range. So remember, for women, it's 1 drink per day. For men over the age of 65, it is also 1 drink per day. Next, we'll talk about being physically active. So this is something that we need to make sure we're incorporating into our daily lives. Staying active is very important, not just for our blood pressure, but also for our overall well-being. There are 4 different types of exercises that we should be incorporating in our daily routine. Those are endurance, strength, balance, and flexibility. So the endurance exercises, those are sometimes called cardiovascular or aerobic exercises. Those are the ones that are going to get your heart rate and your breathing a little elevated. That should be incorporated every day if possible. Your strength, balance, and flexibility, those are going to, number 1, help with your overall well-being and health. They're also going to help with your risk of falling. As well as all 4 of these different types of exercises will help with your blood pressure, keeping your blood pressure within a good range. So you should make sure that you're maintaining a healthy weight because as we discussed, being in the overweight or obese range puts you at a higher risk for high blood pressure. as well as developing some of the side effects from high blood pressure. So we do offer a body composition analysis here within the Villages Health. It's a completely free assessment tool that we can use. It assesses your weight, body mass index, your BMI, your body fat percentage, basal metabolic rate, fat mass, fat-free mass, and hydration level. So you come into the office, you tell us your height and your age, you take your socks and shoes off and step on what looks like a regular scale. And it gives us all of that information. It prints it out on a little receipt, and then it's your way of keeping track of your progress. Keep in mind, if you do have an implanted electronic device like a pacemaker, or if you are pregnant, you cannot participate in this screening tool. There's no registration required. This is a walk-in screening during the listed times in our calendar. But if this is something you want some more information on, please contact the Learning Center within the Villages Health, and they can get you any details that you'd like. So quit smoking. Now, smoking cigarettes as well as exposure to secondhand smoke increases your risk for atherosclerosis, which is a process that high blood pressure is known to accelerate. That's that narrowing within your arteries that can lead to heart disease, heart attack, or stroke. Every single time you smoke, it causes a temporary increase in your blood pressure. So think about those people that you know that are chain smokers that smoke a few packs a day. Every time they smoke, their blood pressure goes up. So what if they continue to smoke as they're sitting outside, cigarette after cigarette? Just imagine what their blood pressure could be. It could be very, very elevated. So if you do smoke, tobaccofreeflorida.com is a wonderful resource. You can go on their website. They can provide you with free resources as well as some lozenges, gum, or patches to help you in stopping smoking. Now, the other thing that we'll discuss is stress. So having added stress can put you at a higher risk for high blood pressure. So some ways that you can manage through some stress is maybe count to 10 before you speak or react. Now that react may even be your body reaction, your face, what you say, or even what you do. So count to 10 before you react in any way. Maybe take a few slow, deep breaths until you feel your body is unclenching and the stress is even minimalized just a bit. You could try going for a walk, even if it's just to a different room. It can help break up the tension that you're feeling and give you a chance to think things through and maybe react a little differently. Now, some of the medications that are prescribed or that can be prescribed for blood pressure can also be used for different diagnoses as well. These are the common ones that we see that are usually prescribed for high blood pressure. So your diuretics, that's your water pills, beta blockers, ACE inhibitors, calcium channel blockers, vasodilators. Those are just a few of the listed here, but depending on your other medical history diagnoses that you have, as well as the other medications that you're taking, your doctor may prescribe these or a combination of these to help get your blood pressure under control. It's always a good idea when you're getting a new blood pressure medicine or any medication at all to talk to your doctor or your pharmacist to make sure that you're aware of what the medication is, what the side effects are, and any other questions like what time of day should I take it? Should I take it with food, water? Do I have any restrictions when I start it? Things like that. It's always good to ask questions. So that's what your doctor and the nurses are there for. We can't read your mind, but it's a good idea to ask questions so you have a complete understanding of the medicine that you're going to be taking. Make sure that when you are purchasing any over-the-counter medication, you're always reading those labels. So some even over-the-counters can have a warning that says it may cause elevated or high blood pressure. Some decongestants are not suggested for people with high blood pressure. So it's always a good idea to read the warning labels, talk to the pharmacist when you're trying to get an over-the-counter, just to make sure. You always want to be sure. So in summary, so most cases, an emphasis on the word most there, high blood pressure can be controlled with medication and lifestyle changes. Make sure that you're checking your blood pressure regularly. I will also add to that, if you have a machine at home, make sure you're changing out your batteries every 4 to 6 months, because having old batteries can actually give you inaccurate readings. So make sure that you're changing your batteries every 4 to 6 months and keeping a log of your blood pressures to take into your doctor so they can see how you're doing at home. If you notice that your blood pressure is starting to climb, if it's getting a little higher than your normal, let your doctor know, because they need to know and they need to be able to monitor it more closely to see if there needs to be some medication adjustments. And then if you do take medications, if you're started on a new medication, if you notice that there's any new side effects, you should let your doctor know immediately, because they may need to change you to an alternative medicine for your blood pressure, but that would cause less side effects. So again, you are your body's best advocate. If anything changes or you notice anything different, talk to your doctor. Your doctor is a team with you and your nurses and your regular support system to be able to keep you as healthy and active as we possibly can. These are some of the resources that we used for this seminar. The top one is the American Heart Association, which is www.heart.org. They have wonderful resources on here for high blood pressure. The other resource is the National Heart, Lung, and Blood Institute. That's www.nhlbi.nih.gov. Both are great resources that you can get free information on and learn a little bit more about what we discussed. I hope you enjoyed the presentation today. Again, if you have any questions or comments, please feel free to contact the Villages Health Learning Center. I hope you have a great day.